Hello, I'm Ellen Fanning and my guest is Dr Susan Pedersen, who is the Director of Water and Health Proprietary Limited and is an international expert in water-related microbial risk assessment. She has been involved with the World Health Organization Working Group for Harmonisation of Microbial Risk Assessment since 2009. And she's the lead author of their QMRA guidance document, which was launched in July this year. Thanks for joining us. Let's start at the beginning. You're talking about managing the risk of unsafe water in developing nations. What's the role of the World Health Organization? I would have thought such guidelines already exist.
Well, drinking water quality guidelines have been published since mid-last century. And the role of the World Health Organization is really to provide a scientific base, a guidance level for countries for the member states that don't have that themselves. And it's a reference point for countries to look to for where to set their own national guidelines.
And in terms of what makes a difference, trying to identify what makes a difference to the production of clean water in various settings, you're talking about developing nations which maybe don't have a whole bunch of data. How do you know what to do and how do you measure whether or not it makes a difference?
It's a real challenge, and the WHO guidelines are intended to be universal, so to apply in developing nations and in developed nations like Australia as well. The challenge is that the agents that cause disease can't be measured at reasonable concentrations in safe water. There's nothing to measure in that glass of water that can tell you that it's safe to drink. The only way to know whether it's safe to drink is to look at where that glass of water came from, what its history is, where was that water sourced from, how's it been treated, how has that process been controlled and managed along the way to ensure that it's safe to drink. WHO has adopted a risk-based approach since the around 2000s in looking at source-to-tap consumption, and we've adopted that in our Australian guidelines, and now it's really international best practice to manage water safety using that approach. Now, how does that apply in developing countries? The same approach is true, but the levels of endemic disease are so much higher, it's difficult to tease out what the next best thing is to do. And so by modelling what pathogens are most important in a particular region at a particular time, looking at how well different barriers perform against those pathogens. Different barriers will, for example, chlorine performs very well against bacterial agents, but against others like protozoa that cause cryptosporidium, it's not so effective. You need other processes like a filtration process to remove the cryptosporidium. Yeah, or you need UV, or you need some other kind of intervention that's going to work against that specific pathogen. And that's why the science base is so important. That's why we need the pure science to help us understand these organisms, understand how they respond to different treatment measures, and also to understand what's happening in the natural environment. So when they're in that natural biome with all the things that are going on in the water, how does that impact how the different barriers are going to work? This is all really critical to trying to predict what might happen, and then afterwards to try and see what's happening in the real world.
And so you're working backwards and forwards. You're sort of working on not only best practice, but you're actually asking very specifically in a given setting in a developing nation, what problem with the drinking water are we trying to solve here?
Exactly.
And how might we go about solving it, as well as looking right up the chain to see what the risk factors are.
Exactly. And we all want to have the same universal water safety targets globally. Everyone deserves safe water. It shouldn't be a different target for some countries and for others. But we've got to be realistic about achieving that. And so it's about looking at what's the next best step in terms of economic, social, and most importantly, health outcomes. What is really going to make a difference for the next thing that we're going to do in that setting?
Using that science to drive a spirit of inquiry, give us a case study of that with Legionella. You see an outbreak of Legionella and everybody says, quick, work out how that happened and where it came from.
Exactly. And Legionella is a really important example because even though it's quite rare, there's only a few hundred cases reported nationally in Australia every year, it's severe. And so it's really important, and it tends to affect our most vulnerable elderly people in healthcare settings, etc. So it is important, but there's only limited information that we can get from looking at reported cases and where we think that person may have been exposed or where they might have got sick. But if we go back to the science and we look at what we're learning about Legionella and how it behaves in the environment, and we can look at how it behaves in plumbing systems in buildings and how it seems to be growing in the biofilm. It seems to be protected by amoeba in the biofilm. At certain situations allow it to amplify to very high numbers in a relatively short period of time if it gets the right temperature. So we're starting to piece together from the science what we think might be going on. And really it's making us now think, well, there's a broad range of situations that could potentially be risky situations for opportunistic pathogens like Legionella. And we need to be thinking more broadly about when people might be at risk and looking at managing them more carefully, looking at keeping hot water hot and cold water cold. We don't want warm water. We don't want stagnant water. We want to minimise aerosol exposure. These kind of basic things to do with risk management for the whole community to try and ensure that we're protecting public health through, buildings as well as our natural environment.
So if you're talking about keeping hot water hot and cold water cold and so forth, what you're saying is it's out in the environment. We're just going to manage the risk rather than pretend we can isolate the source of every outbreak. Is that right?
Well, exactly. I mean, Legionella is a naturally occurring organism in soil. It's everywhere. If you go and look for it, I'm sure you'll find it. So it seems to be if you create the right conditions for it to amplify, that's when we're really looking at, a risky situation. So, and in plumbing systems appears to be, an important risk factor.
So if you know that, what do you do differently? If you take that approach, what do you do differently?
A lot of it's about design of the plumbing system in the first place. So to make sure that it's designed carefully, keeping in mind your desire to keep hot, hot, cold, cold, and to avoid stagnation. So in designing it to the different rooms in the house, the different faucets, in buildings, in schools, in public areas, making sure that you are keeping the water moving constantly is really important. And in old buildings that had been constantly modified, they cut off the pipe and then they just put a cap on it and they don't actually get rid of that stagnant piece of pipe. And so we're getting more aware of these important risk factors and controlling them and allowing that to drive how the building is designed, retrofitted and managed to protect public health.
Wonderful to talk to you.
Thank you.